All right, with extreme times, I've got to give extreme advice. So we're gonna fix your sciatic pain right now. I have lots of clients out there. I can't see you right now, but I've come up with a protocol to fix that sciatic pain and give you some relief. So first thing, we're gonna release your sacral ligaments. We gotta get in there, we gotta get aggressive because everything around that sciatic nerve is inflamed, lit up, and not moving well. So we gotta attack those sacral ligaments. Next, we gotta attack that low back muscle, that quadratus lumborum, which is usually responsible for one side of your pelvis being higher than the other. We gotta get in there, we gotta teach you how to self-release that. Next, we gotta get that sciatic nerve moving. That sciatic nerve is so tense right now that every time you bend over or you lift your leg up in the air, you're getting pain. Okay, so to start, what side do we work on? It's not always the painful side, but we're gonna test that sciatic nerve before and after. So you'll notice that when you do leg lift on one side, you're either getting pain or it's the side of nerve tension, so you're not getting as high on that side. That's the side I want you to focus on. All right, so firstly, we gotta attack those sacral ligaments. So what I'm gonna get you to do is basically, when I talk about the sacrum, it's basically that tailbone, that bone in between your butt cheeks, right? So it kind of sits in that position right there. And what we're gonna do is we're gonna take a ball, preferably a bigger ball, like a softball or something like that, but you can use the lacrosse ball, you just gotta prop it up onto something like a yoga block. So what you're gonna do is we're basically taking the bone or taking the ball and we're placing it basically into the sides of the sacrum where it meets the ilium or the bone on the outside. So you're basically thinking almost right on the bone. So we're gonna take the ball and what you're gonna do is you're gonna place it on that area. You kind of roll around until you're you're pretty much right on the bone. The periosteum or the bone tissue has some of the most dense nerves in the body, so it's going to be really sensitive. So you're going to basically go into those spots, kind of roll up and down that sacrum until you find the most tender piece on that bone. And then when you're on that position, what you're going to do is you're basically going to lay on your side and you're going to bring your knee up towards your chest, straighten that leg out, and then lift up off the ground, and then reverse. Find a new spot, bring that knee up, straighten that leg out, and lift. And we're gonna do that until you get all the way up that sacrum. Spend enough time that you can actually notice a difference. Of course, it's gonna be painful. We should be in that 6 to 7 pain range, but we also shouldn't be reproducing that sciatic pain. Okay, next, we gotta release quadratus lumborum. And to do this, basically you're gonna find the bone right on your back here and you're coming right just above it. So right here, and you're again pretty much on the side of the bone. Now, from here, what you're gonna do is you're gonna roll around and you're gonna start in basically the fetal position. So you're starting in this position here, and you're finding that tender point on the bone. And then basically what you're gonna do is you're gonna extend this arm overhead. And as you extend this arm overhead, you're gonna bring this leg down underneath your other leg and lift. And then repeat. So here, roll around, find a tender point, extend and lift, okay? And again, spending time working on those tender points until you notice a difference. All right, so now that we've worked on those sacral ligaments, we freed up that quadratus lumborum, we gotta get that nerve moving and keep it moving so that the body can start to heal itself. So what we're gonna do is you're gonna basically sit on the end of a chair, and as you look up, you're sitting nice and tall, as you look up, you're gonna extend that leg. And then as you look down, bring the chin to the chest, you're gonna curl the leg in. So up and up, down and down. So each rep should last about 5 seconds. And we want to repeat this gently for 10 reps. So again, up and up, down and down. Give it a try. Give those 3 exercises a try and let me know how you're feeling, because I want to make sure that you're not in pain.